same level of service to be able to bring people in, get them evaluated, get them treated, send them out for imaging. Oftentimes, and anyone from Canada? Okay, So I oftentimes have my Canadian patients come in, and they get evaluated, or they get they get in right away, and I say, well, let's go ahead and get some imaging. We'll get an MRI, and we can send you over to Acumen or whatever the MRI center is. It's $350 self-pay, and you can get in today. And they go, what? Because it takes them 6 months to be able to get anything done. And so, but that's often what we do to be able to find out exactly what the problem is, and then we can go ahead and design a treatment program to be able to get you the results you're looking for. So, with that being said, that is me, and I'll introduce my my esteemed advanced nurse practitioner, and Dr. Collins.
I'm Dr. Collins.
Over here a little bit.
Oh yeah, I have to get over here. I'm Dr. Collins. I have a registered nurse degree, a bachelor's in nursing, a bachelor's in biochemistry, a master's in nursing, a master's in or molecular biology, and then a PhD in research. My background has been dealing with non-common issues. So a lot of patients that have had Lyme disease, fibromyalgia, chronic type things that have been punted from one specialist to another. And because of that, I got really interested, and because of also living and growing up mostly in the UK, really interested in treatment plans that were working there but were not being offered here in the United States, or were being offered but by very few individuals. So therefore, patients didn't know what an option might be. So it might be surprising to all of you that stem cells were started as late as the 1970s. So they had been used even before that time, but in the 1970s used exclusively quite a bit, instead of doing a shoulder replacement. For those that wanted that option of not having a shoulder replacement, they would use the stem cells. So when you see advertisements in the newspapers here for latest, greatest option for a joint replacement, and they mention stem cell, I have to kind of laugh, because 1970 to 2025, I don't think is latest and greatest, because I've been practicing over 40 years. So for me, that's a long time ago, so even before that time. So I'm glad that it is an option, but again, because of some of those practices that I had been exposed to, and because of just kind of being a forward thinker, I'm glad that we're getting some options and having options here, and these options work, and that they can be available for patients, so that you don't have to have surgery, you don't have to have treatment plans that go on and on and on for a long period of time. But they're very successful, and then you can move on with your life and be very healthy and happy with those choices.
Okay. All right, let's jump into it. So anytime, well, Janie can attest to this, you don't have to be a pro to be treated like one. And one of the things, I was interviewed on a podcast just a few days ago, and one of the questions is what is one thing that sets your practice as a unique, and that's, I would say, our patient experience. Usually when somebody calls the office, you get Joanna at the front desk. We get you treated right away. Coffee is offered. We really try to make sure that you feel at home, so that you feel comfortable. We try to answer all your questions when you're going through the process. And really our level of service is, I think, just unmatched. We haven't come up with anybody yet. We've successfully treated with our treatments a variety of different things. Of course, your bone-on-bone arthritis, rotator cuff labrum tears, shoulder injuries, neck and back and hip injuries, foot and ankle injuries, plantar fasciitis, and probably a bunch more. So we're able to take and treat these with our process by making sure that we carefully analyze them and then design a treatment program that's specifically designed for you. Now, we typically have our kind of cut and dry, rotator cuff tear is going to take this and this, but then we also have some complicating factors with patients, and we take and customize those care plans to those individuals. So this is a demonstration of a rotator cuff injury. So this is a rotator cuff supraspinatus muscle.
So here, shoulder.
Yep, right in the shoulder. And you can see how the tendon tore in that particular case. Now, I always explain that tendons can tear in 5 different ways. One, it can completely tear and retract, just like that showed, where the muscle goes into contraction and then it pulls the tendon away. That is typically something we can't treat. That's something the surgeon has to go in there, grab that piece, and then re-adhere it to the bone. However, the other 4 ways that tendons can tear, we typically can treat. And that is a partial tear like this, interstitial tear they call it, where the tendon on the interior fibers break apart like this. Okay, you can have an enthesial tear where the tendon tries to pull off the bone, and then they can fray like a rope. Now, the very similar thing with ligaments is ligaments can tear the same way, but they don't fray like a rope typically. You can have an enthesial tear of a ligament. For example, I had tears in my right ankle and did our process, and I can run on it. But partial tears, enthesial tears, you can have tears that don't necessarily retract, but sometimes the gap in between those 2 pieces is too much. So those are some of the simple types of things that we can, not simple, but the types of things we can treat. So this is an example of a meniscus tear. Here's the meniscus, here's the tibia or the lower leg bone, and you can see how that shock absorber has frayed open and opened up. That's a circumferential tear, but they have a bunch of different types of tears that can happen in the knee. So like a bucket handle tear, you can have osteoarthritis and degeneration, which the next video shows the quote-unquote bone-on-bone arthritic change that can happen. Any of this can happen in any joint in the body. Okay, it can happen in the shoulder, it can happen in the AC joint, it can happen in the knee, happen in the elbow, wrist. You can see how that cartilage is weakening there. One of the things that happens in these types of injuries and what leads to that arthritis is almost invariably instability of the joint. So from chronic wear and tear, chronic postural problems, chronic abnormal use, partial tears that happen in the rotator cuff or some of the supportive ligaments. What those do is they provide support to the joint, and if they're weakened, they can become unstable. That causes the joint to move around too much, wearing down the cartilage, causing inflammation that is chronic, where the bone starts to deteriorate. You get bone spurs and all those nasty types of things. So your traditional interventions are things like pharmaceutical drugs, cortisone injections, physical therapy, and surgery. Examples of your pharmaceuticals, your anti-inflammatory medications, pain relievers, and muscle relaxers. Now, one thing other than the fact that, pain medications can be addictive, anti-inflammatory meds and non-steroidal anti-inflammatory medications, is the literature is very, very clear that the chronic long-term use of those medications accelerate arthritic changes. And it can cause, gastrointestinal things, and there's, other side effects. So cortisone injections, over the long-term use of cortisone injections, cause this lovely list of things that can happen. And there's a very specific reason why things like cortisone and non-steroidal anti-inflammatories accelerate arthritic and degenerative changes of a joint. It's a complex process, but it's relatively simple. What it does is it shuts down inflammation. And it's important to understand that inflammation is actually an essential component to the healing process. If you don't have inflammation, you don't have the subsequent healing and stimulation of the immune system to heal the tissue. So for example, anyone cut their arm before? Okay, and what is the first thing it does? Starts bleeding, okay? It gets inflamed, it gets irritated. It's an inflammatory reaction that is the body's process of, starting in fact, there's 3 phases of healing. The first phase is called the acute inflammatory phase. You have to have that. The next is the proliferation phase, where the body starts to lay down new collagen fibers, and then those collagen fibers eventually go to the phase 3, which is your remodeling phase. So those collagen fibers turn into new skin, new blood vessels, new epidermis, and new cells. Okay? The important thing is that you have to have inflammation to get to that, get that process going. Okay? And in fact, if you look at most of the modalities now that we use in sports medicine, so things like laser therapy, acoustic shockwave therapy, prolotherapy, they actually trigger a targeted inflammatory reaction to stimulate the body's own immune system. Okay?
So it's controlled.
But it's controlled.
We're doing a controlled inflammatory reaction or response.
Mm-hmm. So traditional physical therapy is, let me back up because that jumped ahead. Traditional physical therapy is different than what we do here. In here we do corrective exercise, and here's the reason. Most of the time from a physical therapy standpoint, the emphasis is on getting somebody to the activities of daily living. Can you wash yourself, take care of yourself, feed yourself, bathe yourself, clean yourself? It's pretty much what their objective is. Our objective looks way beyond that, because we want to get you to be able to go play golf and go play tennis and go resume full activities. And that's a far cry from, can you walk from your bed to the bathroom? So we want to make sure that we get you to a level that you can really function and really get your life back. Okay? Corrective exercise is essential simply because of the way the neuromuscular system and how the body adapts and compensates to chronic injury. Okay? In fact, I've written a paper and submitted it on neuromuscular adaptations and compensation patterns following acute and chronic injury. So the easiest way to understand that compensation pattern is you've sprained your ankle, and what do? You limp on it. Okay? That is a neuromuscular pattern that gets developed in your nervous system, in your brain, and in your system. Some muscles overfire, other muscles underfire and don't fire correctly. Even after you have a total healing of the ankle, there'll still be that neuromuscular pattern in the system. The corrective exercise we do corrects for that. And that is a huge component in the results that we get. So, there's other facilities where you can go in and you can get a stem cell injection, or you can get prolotherapy or PRP, or you can get these other modalities, but they don't address some of these other things that are more of a long-term correction and essential. So in your case with the back injury and previous surgeries and things like that, dynamic core stabilization exercise, corrective exercise would be an essential component for anybody that is trying to recover from something like that. But it's true with knees and shoulders and elbows and wrists and everything else. So let's talk about things like the things of regenerative medicine and what regenerative medicine is. Regenerative medicine is that classification of medicine that does exactly what the title says. It helps to regenerate tissue. We're not trying to cut things out, drug things to suppress function. Our objective is to work with the body's immune system and get that functioning to where we can stimulate healing in a targeted way. Class 4 laser therapy is a non-invasive treatment, but it uses high-powered infrared light, and the photons of the light actually penetrate through the skin into the tissues and stimulates the mitochondria. Remember the word mitochondria because it's important when we come up to next topic. But it stimulates mitochondrial activity. The net effect of the laser therapy is that it increases circulation, so it brings new oxygenated blood in and around the tissues. It decreases swelling, decreases pain, and in joints it increases range of motion. I will let Catherine talk about the injection therapies that we do.
So injection therapies would be prolotherapy. So with prolotherapy, I'm using dextrose, normal saline, and lidocaine. But the purpose of the dextrose or the prolotherapy is to create inflammation, because again, that's our normal body response to begin a healing process. So the dextrose is creating that inflammation, controlled, and then what it's doing is rebuilding, repairing, laying down some new layers. So great therapy with doing the prolotherapy. It works, it'll get you to your goal, but it's just a little bit of time to get you there. So a little bit of working with some changes in your everyday activity or things that you're eating or drinking, but it'll get you there. And then the next is the stem cells. So the stem cell that we use is from a company called New Life. And we combine the stem cell also with a product known as Wharton's jelly. So the nice thing about that is we're getting a good high quality stem cell, but we're also getting an activator with the Wharton's jelly. And now we're also getting double the amount.
So our differentiator for if we're going to choose between the prolotherapy or a stem cell is the prolotherapy works great for tendons, ligaments, and muscle. It doesn't work particularly well for loss of cartilage, arthritic changes, and that type of thing. Not to mention the fact that as somebody gets older, if somebody's older and they have a long-term chronic injury, we get better results with the stem cell. So and then, you know, usually if somebody's got a chronic injury, they also have some cartilage loss and they have that process started. So there's two different types of delivery of the stem cells. There's autologous stem cells and allogeneic stem cells. Autologous stem cells are stem cells from your own body, okay? They can extract some abdominal fat or do a bone marrow aspiration. Talk about your, you know, invasive. A bone marrow aspiration, and then they process it, and then they give you your stem cells back into that joint.
After all that trauma that it's gone through.
Yeah. Which is, it sounds okay on the surface as far as results go, but the problem is your stem cells are your age. So they've lost their function. They've become, well, you know, that's the aging process. And when we're born with, you know, trillions of stem cells, and they're all active, they're all full of mitochondria. Remember I talked about mitochondria when we were talking about laser therapy? The fuel or the energy generator for every one of our cells of our body, including our stem cells, is mitochondria. So by the time we even reach puberty, we've lost 90% of the activity of our stem cells. Okay, they've lost their mitochondria. They're there, but they're dormant, and they're not functioning. Okay, so and as we age, that number gets less, and as far as active stem cells, that number gets less and less. So if you know, the autologous stem cells, just, you know, unless you're, I guess, a teenager, but still, you're still not getting
not even, unfortunately, yeah. Because we're having more and more exposure to everything being treated chemically. So we have chickens and cows and, you know, everything where they're giving the hormones to them and they're trying to fatten them up sooner to get them to slaughter. We're having all the fruits and vegetables that they're kind of messing around with to be able to get them harvested sooner. So we're ingesting all of that, which is also impacting this number. So if you look...
So in our practice, we exclusively use allogenic stem cells. Now, allogenic stem cells are from very carefully screened, very carefully FDA tracked labs, and they come from healthy umbilical cords. Okay, so the mother is carefully screened and tracked throughout her pregnancy. They agree to go ahead and donate their umbilical cords once the baby is born.
This is the screening.
As well as the Wharton's jelly. And then that is cryopreserved at minus 80 degrees centigrade until it's ready to be utilized. Now, the advantage of the allogenic stem cells is that they're obviously young stem cells. They're all like brand new, has minimal exposure to any environmental toxins, or as Catherine said. But the most important thing is the unique nature of the umbilical stem cells is each cell has up to 300 mitochondria per cell. Okay? When those are injected during the procedure, those stem cells are going in, recognizing their environment, and finding your body's stem cells, giving them, donating them one of the mitochondria to reactivate your body's stem cells, and that's what starts that process to regrow tendons, ligaments, bones, nerves, cartilage, blood vessels, and help to reverse that cartilage loss that you've been dealing with, but then also heal the soft tissues. much superior product, plus the fact you also have the Wharton's jelly with the exosomes.
Is peptide therapy, and the two that are very beneficial for sports medicine or any type of sports-related issues are BPC 157 and TB 500. BPC 157 is derived from gastric juices. So originally, it really came to be known for those that had severe gut issues, severe like chronic celiac disease, gluten sensitivities, just gut, anything from mouth to rectum type issues. So when they were giving it to these patients, though, these patients were reporting all kinds of other things, like I have clearer thinking, I feel more organized, my hair is growing back, my skin has improved, my eyesight is better. Those past COVID, it was being used for long-term COVID or long haulers, they called it. But what they were saying too is that their taste came back, their hearing was improved. I mean, just all kinds of things that we began seeing, but it does help mend with tendons, muscles, and ligaments. So that's one of the reasons why we use that. If we need to use something a little bit, I guess you could say stronger or a little bit more designed for tendons, muscles, and ligaments, that would be the TB 500. But many times we get exactly what we need plus all these other additional things off the BPC 157. So I will utilize that one.
So here are just a couple of testimonials from some of our patients. You guys are going to get this sent to you anyways, the whole video, so you don't have to sit there and read the whole thing. But I do have a couple videos that we'll show you.
I'm Pete Mancinelli. Been coming to Ken for a while. It's been a blessing here. I had a couple tears in the inner and outer ligaments on my knee, and we decided to do prolotherapy. And with that, I had laser, the size to start out. Now I'm doing this physical therapy, and it's really helped me a lot. At night, I would wake up from the pain on my knee, just trying to bring my leg up. Since I've been doing the PT, hasn't bothered me at all. Doesn't wake me up in the middle of the night. It really, really works. And you wouldn't think that you'd be sweating in 30 minutes, but I play softball, and this is as hard a workout as playing a double header, 2 games of softball. So I really thank Kenny. And this and Sarasota sports music. Excellent.
So incredible right elbow pain, especially when golfing, but then later pretty quickly determined with an MRI that I had 2 torn muscles in my shoulder. So needed to rehab the shoulder and the elbow. We started with, I think 10 rounds of laser therapy, and then we did 3 rounds of prolotherapy. And then shortly after that went into physical therapy with a trainer here on site. Results have been phenomenal. So shoulders feel as close to 100% as a 50-year-old shoulders can feel, and elbow feels almost 100%. But it's amazing. It's been an amazing journey over the last 8 months, and now I've come back, and handicap's coming down, and I just shot my best round ever at 76 a couple weeks ago. Yeah, shot par on 9 holes, which I had never done before. And I just did that 3 or 4 weeks ago. So now I just need to put together a couple 9s like that, and I'll be good to go.
Excellent. Well, thank you.